It's 11:50. I'm Mitch Carr. Thank you very much for joining us. Big retailers, you've seen it happening all across North Texas, getting into the healthcare world. We're talking about Amazon, Dollar General, even Best Buy. Many others are getting into it. So what is the future of healthcare? I put that question to Paul Seegert. He heads up PCS Advisors, a health benefits consulting firm.
Well, we're seeing a lot more consolidation. That's been the trend for a long time. We've gotten to watch consolidation amongst hospitals. We've seen consolidation amongst pharmacy benefit managers and insurers and retail drug companies in the case of CVS. And now we're watching, really, I would say it's like an arms race for control of primary care. And if you look at the concern that I have is that in so many other industries, consolidation or vertical integration or whatever leads to more efficiency that's shared with the consumer. That hasn't been the case historically with healthcare. If you look at hospitals, as an example.
For people who have Medicaid, for people who have private insurance, are all of these different providers, wherever they set up, are they taking all the options, or are you going to have to shop around depending on what coverage you have?
Yeah, I think you'll end up having to shop around, and there's some wait and see. It will be part of this. And that will hopefully be somewhat of a check and balance. I mean, in the old system, we had enough separation, not that it worked perfectly, but the whole idea is that you have some checks and balances in a system to help contain cost or encourage competition. That's the challenge I see with some of this consolidation. Is, Aetna and CVS, you've got the drug store, the insurer, Caremark, the pharmacy benefit manager, and now you have a primary care doc. Well, certainly they'll be in network, but do those players, when they're all really under the same umbrella, are they going to negotiate as aggressively to contain the cost? I mean, that's certainly a question we should ask. And for some reason in healthcare, we don't seem to have asked it as much as we have in other industries. Well, that's one of the challenges of our system overall, is that you have Medicare and Medicaid that compensate less than these private payers. Providers historically may have lost money on some of those reimbursements and would do that because they knew that they would have a private payer walking through the door next and they would charge them significantly more. Something that we're watching in our work right now is the trend of more and more people getting their coverage through a government program. It's increased to a point where it's crossed a pretty significant line, in my view. 51% of us now get our coverage either through Medicare or Medicaid. And that's not really a sustainable long-term trend. It used to be that the majority of us, 2 out of 3 of us, go back 2 decades, got our coverage through our employer, and those plans funded the profitability really of the whole system, and the other safety net programs could coexist with them, and everything could operate and function pretty well. And that's really in question now as we go forward.
Paul Seegert at PCS Advisors joining us on the KRLD Newsline.